The new recommendation from AAP, no single phototherapy, no double phototherapy, no triple phototherapy, intensive phototherapy. Hit hard. Okay, the change is that they increase the threshold for phototherapy. They increase the threshold for exchange. Okay, now you will not do the phototherapy what you were doing in 2004 guidelines till 2022, or what you were doing for exchange till 2022. Now the threshold has been increased, but when it touches to the phototherapy zone, then hit hard. Hit hard means 30 microwatt. 30 microwatt is called intensity, okay, high intensity phototherapy. From above and from below. Okay, it can be 180-degree tubes like intensive, or belly blanket from down, or one from down. Two from the side will not, serve the purpose. So maximum surface area and maximum irradiance. No single, no double, no triple. All babies should receive intensive phototherapy, minimum irradiance of 30 microwatt. Okay. So now question is out, that baby should be started on single, should be double, okay? Maximum phototherapy. Okay, 30 microwatt per centimeter square per nanometer should be the irradiance, and all hospitals should have a radiance meter. When you start phototherapy, you should check how much radiance you are providing. Otherwise, it can be a litigation. Have you provided a proper radiation or not? Okay? Because this intensity improves the clearance of the phototherapy from the skin, and reduces the stay in the hospital also, and reduces the risk of rebound also. So that's why it's recommended now. 475 is the LED light, 470. Intensive phototherapy is recommended, okay? Sun exposure can benefit the babies, but hassle and problems are more, risks are more. That's why AAP does not recommend the routine sun exposure for the jaundice infants. Okay, but there is some evidence that sun exposure improves the bilirubin clearance. Okay, but baby can be burned, very harsh light, or baby can be exposed to a cold, and a lot of other problems are there. Now, what we were following since last so many years in our hospital also, and in UAE, AAP guidelines and AAP chart, but they were not stratified based on gestational age. In 2022, they put gestational age as a separate risk factor. Previously, we were following the gestational age plus risk factors. I will show you what are the previous graphs and what are the new graphs. Now the gestational age is a separate risk factor. So 2004 guideline risk categories were low, medium and high risk. If some of you are familiar with those graphs, okay. The low risk were the babies who are equal or more than 38 weeks of gestation without risk factors. And risk factors were same, ABO, race, GCPD deficiency, okay. Or medium risk were the babies who are more than or equal to 38 with risk factors, or 35 to 37 without risk factor. This is the old, I am talking about the old one. And high risk for the 35 to 37 with risk factors. But now it has been changed. 2022 phototherapy threshold for no neurotoxicity. Now they explained neurotoxicity risk factors also. I think I missed this one, the neurotoxicity. Let's talk about neurotoxicity later. Just a minute. Okay. So they now explain the neurotoxicity risk factors, and they devised the two types of the graphs. The graphs for phototherapy with neurotoxicity risk factor, for graph for exchange with neurotoxicity risk factor and without neurotoxicity risk factors. And what are the neurotoxicity risk factors? Gestational age, lower gestational age, ABO or rhesus incompatibility is a separate risk factor, severe sepsis, okay, or severe instability in last 24 hours, or albumin level less than 3 grams. They added albumin as a significant risk factor for carnivorous in the new guidelines. And as you are not familiar, that's why I'm not going to explain you. They changed the parameters like this. 40 weeks and no risk factor, they set 2 milligram higher threshold in the previous 2004, the phototherapy was 2 milligram lower for phototherapy. Now they increased to 2 milligram. 35 and no restricted, they increased by 1 milligram. I will explain you in the next graph. You can see here, these are the new looking graphs. You can see here, these are color coded graphs. Where you see the gestational age is separate restricted. 35, 36, 37, 38. These are the color coded graphs, and this is age. Okay? And you can see here, phototherapy threshold with one or more hyperbilirubinemia neurotoxicity. So whenever you are plotting on a phototherapy chart, you need to ask the question, is there any neurotoxicity risk factor or not? If there is a neurotoxicity risk factor, you will plot on this graph. Then you ask the question, if there is no neurotoxicity risk factor, the phototherapy chart is different, slightly lower, the phototherapy. I will share with you all these. I brought the printouts of all this. You see here, what are the neurotoxicity risk factors? They ask albumin, less than 3 gram per deciliter, isoamine hemolytic disease, D6 period deficiency, or any hemolytic condition, sepsis, or significant clinical instability in the last 24 hours. Okay? This was the old chart which we were following since 1998. These were based on infant at lower risk at 38. These are solid line, dotted line, and dashed line and a dotted line. If you see the previous graphs, 20 milligram was for this category, for this patient. You see the 40-week patient, 4 days old, based on the previous chart, 20 milligram is the phototherapy, for this patient. Okay, at 4 days of life. But you look at this graph now, the new one, 22 milligram is the phototherapy. You got it? So they increase the threshold by 2 milligram in the new graphs, because the research over the last 10 years showed that the kernicterus does not happen at these levels. They are way beyond the level which the people were following for the last 10 years. So that's why the phototherapy threshold in new graphs has been increased by 2 milligram. You see here in the low risk categories. But they segregated the infants in different gestational age. You see, you need to see what is the gestational age, and based on gestational age, you ask the second question, what is the neurotoxicity risk factor? If neurotoxicity risk factor, the graph is different. If no neurotoxicity risk factor, the graph is different, and you will plot like this. Clear? We'll do a small workshop also. You see here, 35 weeker, no risk factor as per old. 48 hour, based on the previous chart, threshold is 13 milligram. This is a medium risk. Okay, 35 weeker baby was categorized as a medium risk, but we were practicing till 2022. Now, it is 14 milligram. Okay, at the gestation, because gestational age is a risk factor. So still it is quite up. It's 1 milligram above. So with the risk factor, the threshold increased by 1 milligram. So now we have a little room to treat the infants. Okay, so this patient doesn't need phototherapy. Still, you need another follow-up on another bilirubin level. If the patient is coming from home, even you can send him home, and you can call him next morning for next bilirubin check. So this is the advantage of these new graphs. You can avoid the unnecessary treatment of these patients. But if they reach to this level, then you cannot avoid the treatment. Then you need to hit hard. Then you need to hit with the proper phototherapy. This is a new change in the American Academy of Pediatrics guidelines. During phototherapy, whatever possible phototherapy should be provided in the mother's room where baby can be fed with the milk. Use of IV fluid is not recommended. There is no point of giving extra IV fluid in phototherapy. Until and unless the patient reaches to an exchange level, there is no point of giving the IV fluid to the patient. Okay? Feeding should be maintained during the phototherapy. Just keep nowadays we have a belly blanket. We wrap the baby in the belly blanket like a jacket, and mother take the baby and feed the baby, and baby is getting phototherapy during that. Total serum bilirubin should be checked after 12 hours of the phototherapy. Okay, during phototherapy, when you start phototherapy of any patient, do the CBC, okay, and check the blood groups, okay, and do the blood grouping and the blood group and DAD test for those patients, okay. GCSPD also need to be checked. It's my practice to check the GCSPD in all patients who need the phototherapy. Okay. So here you can do this practice, but you need to know what is the rate of GCSPD prevalence in this part of the world. Discontinue, but I asked the question. When to discontinue? So you need to discontinue phototherapy when your bilirubin level is at least 2 milligram below the phototherapy level. At least 2 milligram below phototherapy. Okay? And then you need to check the rebound after 12 to 24 hours. Okay? Or even 24 to 72 hours, you can check rebound in the low risk category. High risk category, then you can check earlier rebound. 12 to 24 hours, you can check the rebound. Okay, so you can do the rebound earlier if you think that patient, have a DAG positive and a suspected hemolysis is going on, then you can check the rebound early. Okay. The new guidelines offer the home phototherapy, which I'm not going to discuss here because we are not going to offer the home. Even in UAE, we are not offering the home phototherapy. Now, exchange threshold.